Let's discuss the bladder channel primary pathway. The external pathway of the bladder primary channel begins at the inner canthus of the eye at bladder 1. This point is reached by a branch that separates from the small intestine primary channel at small intestine 18. Hand-foot pairing of the second great circuit, yang axis tayang. The external pathway ascends to the forehead where there intersects with DU24 and GB15, continues to the vertex and there connects with DUMI at DU20. At DU20, two branches separates from the primary channel. One branch travels to the temporal region and intersects the gallbladder primary channel at GB8, GB7, GB9, GB10, GB11, and GB12. The other branch penetrates deeper into the brain and re-emerges at DU17, or according to some authors, at bladder 8. From DU20, the external pathways run to bladder 8, and bladder 9 passes DU17 and continues to bladder 10 in the occipital region. Here, the external pathway of the channel separates into two branches. The medial branch runs to DU14 below the spinal process of C7 where it meets the other young primary channels, then continues to DU13. From T1, it runs parallel to the posterior midline, 1.5 lateral to it. At the level of L2, it enters the abdomen and reaches its paired sum organ, the kidney, containing two organ, the bladder. The external branch runs through the gluteal region and the thigh to the popliteal fossa, bladder 40, where it reunites with the lateral external branch. The lateral branch runs from bladder 10 to bladder 41 at the level of T2, from where it descends down back 3 tune lateral to the midline to the level of the fourth sacral foramen. From there, it traverses the gluteal region to GB30, continues along the posterolateral aspect of the thigh, and meets the medial external branch at the popliteal fossa. From the popliteal fossa, bladder 40, the channel descends along the posterolateral aspect of the foreleg to the foot, passes the lateral malleolus, travels along the lateral border of the foot to the lateral corner of the little toenail to bladder 67. From here, a branch travels to kidney 1 located on the exteriorly paired kidney primary channel, foot yin-yang pairing of the second great circuit. Clinical importance, exterior signs and symptoms, chills and fever, headache, occipital stiffness, pain in the lumbar region, obstruction of the nasal passages, eye pain with tearing, pain along the posterior aspect of the hip, knee and foreleg, foot pain, interior or sunk organ signs and symptoms, pain and tension in the lower abdomen, retention of urine, enuresis, psycho-emotional disorders, opistotonus. Connections and meeting point of the bladder primary channel. The connections with other channels, kidney primary channel, connections, foot yin-yang pairing of the second great circuit, location bladder 67 to kidney 1 on the foot, circulation circadian according to the organ clock, importance, exterior-interior relationship. Small intestine primary channel connection paired according to the 6-channel theory, hand-foot pairing, thigh-yang. Yang axis of the second great circuit, location SI18 to bladder 1 on the head. Circulation circadian according to the organ clock, importance above-below relationship. Connections with other some organ system, kidney, bladder. The bladder channel starts at the inner canthus of the eye. It ascends to the forehead and joins the governing vessel, the DUMI, at the point DU20. From here, a branch goes to the temple. From the vertex, the channel enters the brain to re-emerge at the nape of the neck. From here, it flows down the occiput and all the way down the back. From the lumbar area, it enters the kidney and bladder. Another branch from the occiput runs down the back along the medial aspect of the scapula, down the back to the gluteus and the popliteal fossa. Here it meets the previous branch and runs along the posterior aspect of the leg to end at the lateral aspect of the feet toe, where it links with the kidney channel. Overview of bladder points. Affect back of leg, anus, back, bladder, neck, head, brain. Treat backache. Affect the eye, expel exterior wind, extinguish interior wind, affects all internal organs through the back transporting points.